Hello YouTube, and welcome back to another video.
It's gonna be a pretty day for me. I throw my hands up in the air, I'm free. It's only time I know.
This video is gonna be really short, and I'm dedicating this video to my nursing students, LPNs and RNs. All right, let's get prepared for clinicals together. I know clinicals can be very stressful, can be very nerve-wracking, intimidating. However, it is a great opportunity to get to know firsthand what goes on in the hospital, what we do in the hospital, okay? So if you have that opportunity to have in-person clinical, it is amazing. Embrace it, learn from it, get every information possible that you can get out of your clinicals rotation. So let me give you a little insight about what to expect. When you get to clinicals, you are going in a group with your professor and your classmates. So once you get there, you're gonna be paired up with nurses, okay? Maybe you and one of your classmates will be paired up to one nurse, or it might just be you paired up to that nurse. And for that day, you will be expected to shadow the nurse, see patients, assess patients, possibly give medications. Now you have to understand, doing your first ever clinical rotation, you might not have a lot of responsibility given to you at that point because you are just learning. You are very brand new to this. So they possibly just want you to just observe and see how the nurses work. But as your days go back in clinical rotation, they are definitely going to give you patients and have you give medications. So what do you need to prepare you for clinicals? What do you need in your clinical rotation bags? You need, number one, a stethoscope, a very good stethoscope, all right? Because you're gonna put into practice all of those long sounds that you have been learning in the classroom to practice. So you need a very good stethoscope. And take the opportunity to listen to patients who has COPD and asthma, emphysema. You're definitely going to learn the different long sounds, the normal from the abnormal. Number two, get yourself a good medication reference guide, okay? I know in this 21st century, we are used to popping up our cell phones and looking up apps to get medications. Get yourself the medication guide because it is always there. Your cell phone can malfunction, but the medication guide cannot malfunction. So if you are going to see your patient to administer medications, your professor and the nurse that you are assigned to are all looking to see that you know the name of the medications, the reason for why you're giving the medications, and the common side effects for the medications. So before you go into administer medication, go through the drug medication guide, write down your medication, and write down those simple information that you will need. Because if the patient asks you, what is this medication for? And you are not able to say it, it does not look good on you or your professor or the nurse that you're rotating with, okay? Number three, get yourself a good reference RN guard, okay? I'm gonna link one up here for you. Now, when you are in clinical rotation, your professor is gonna have you do care plans. And this guard is very important in helping you complete your care plans. It helps with nursing diagnosis, intervention, implementations, and evaluations. And they all give you the rationales. So it's gonna be a great resource for you to complete your care plans, okay? Number 4, make sure you know your common lab values. It is very important. Potassium, calcium, hematocrit, hemoglobin, white blood cells, red blood cell, platelets. Know those references, all right? They have a lot of resources on Amazon. I'm gonna link one here for you. It's a pocket guard or a little clip you can clip on your badges. So whenever you need reference, you refer to it. We're not asking you to memorize these things, but be able to have the resources to refer to in the time that you need it, all right? Last but not least, make sure you have a Q&A book, a question and answer book for the NCLEX. Start your studying early. Practice questions. When you start early and you are done preparing for your NCLEX, it's gonna be a breeze. You're gonna be more familiar with the questions styled that comes on the exam. All right. Finally, make sure you take the opportunity to ask questions. Ask questions during clinical rotation. Volunteer yourself. Ask the nurses to let you have that hands-on clinical experience. All right. Ask them to prime or IV line. Ask them to administer IM medications, sub-Q medications, complete wound cares, whatever experience that you can get while you are in clinicals, take the opportunity to give it. I see a lot of students just stand by and fold their hands, and there are other students who really get in there and ask you, can I do this? Can I do that? When I precept students, I make sure I give them the opportunity to learn, to do it. And there is nothing more, what can I say, accommodating than being able to do it yourself. That way, once you transition into your position, you already have those experiences. All right? Clinicals can be very intimidating. However, you can definitely do it. You got into nursing school, you can go through clinicals. That's your best opportunity to learn, to see firsthand what nurses go through. Okay, I wish you the best of luck on your clinicals or in nursing school. Any question, comment, leave a response, tell me your experiences in clinicals, and I will definitely get back to you. I appreciate all of you viewing and commenting and liking. This family is growing. I am so excited to be putting out this information, and I look forward to seeing you on my next video. Take care and bye for now.
It's gonna be a pretty day for me.